Most of the analysis and training examples and ideas that I'll be presenting with Bronwyn and Michelle relate to people with stroke and brain injury and other neurological conditions, but I've certainly used a lot of the principles with teenagers, school students who've had problems with legibility and messy writing. So you can apply the principles and use the same assessment details and measurements with different populations. And I guess one key point to mention is that the information we're presenting assumes that the person with stroke or brain injury has the ability to hold a pen or a pencil and to make a mark on the page. Many people who have handwriting goals can't pick up a pen, and we're not providing interventions for that population. I acknowledge the traditional custodians of the land that I'm occupying today here on the central coast of New South Wales, on the eastern seaboard of Australia. And I pay my respects to their elders past, present and emerging. Bronwyn, who's presenting today, is in Sydney, south of here, and Michelle, who's joining us but isn't presenting today, is up in Queensland in the northern part of Australia. The plan, we've got two parts to the session today. The first is about analysing and measuring handwriting, and we'll be presenting on the Handwriting Assessment Battery that some of you will know. And different features that we can and should be measuring and giving feedback to participants about, such as legibility, neatness, speed, and so forth. Then the second part is on retraining handwriting, and Bronwyn will present her master's research, which involved a task-specific training study with stroke survivors living at home in the community. And I'm going to start by talking about the evidence on handwriting interventions because it's very short and it won't take me very long to go through. The take-home messages from this session are that we want to be able to give feedback to participants about their handwriting so that they can see this change in their performance, whether it's to do with pen control, legibility, speed, or neatness. It's a good principle in rehabilitation. When we are delivering intervention, it should include practice of handwriting. Now, we're going to talk more about this, but that's what task specificity means. If somebody wants to improve their handwriting, they should practice using a pen or a pencil or an implement, not doing things other than writing. And as with all of the upper limb interventions that you'll hear us talk about, intensity should be high enough to make a difference to performance. So we're looking at least 20 sessions, and I'll tell you why, which might involve picking up, manipulating and rolling a pen to improve control of holding and using the pen, small amounts of writing, and I'll tell you why shortly, and counting repetitions, which might be letters, words, or sentences of practice. And we should be looking at doing self-generated writing, such as shopping lists, ideas that you might be wanting to write down, messages to yourself, as well as copying tasks, because the majority of writing that we do in a day is much more likely to be self-generated text, not copied text. And the majority of people's goals are going to be focused on legibility and neatness, the look of their handwriting, rather than speed. So make sure that you're attending to those priorities and those goals. I'm going to start with a video of a man who was one of the participants in Bronwyn's study, and he wanted to be able to improve his pen control and his legibility and neatness. And I'll give you a few seconds to watch this man as he begins to write and have a think about why he might be having difficulty generating text on the page. And think about what you might do for this man. You don't need to type this in the Q&A box, but just have a think to yourself. Where do you think he's having problems? What kind of intervention would make a difference to this man? And you'll see this man 2 or 3 times doing this. It's on a loop. But after he writes the first stroke, or makes the first stroke on the page, he starts to lose control. So at this point, his index finger and his thumb are on the barrel of the pen. As soon as he starts to put any pressure on it, his index finger slides off and his thumb slides off the back of the pen. And my hypothesis here is that his interossei muscles, which control the pen, and his index finger on the pen are not working well. They're very weak, or they're not working at all. And he's using his long finger flexor on his index finger too much to try and hold onto the pen. And as a result, his index finger is sliding off the side of the pen. He's also not able to oppose his thumb on the other side of the pen. So he's got problems with his interossei muscles and the small muscles of his thumb. So they would be the focus of my training for somebody with this kind of difficulty. And I would expect if he tried to pick the pen up off the table, it would probably twist and rotate, and he would have difficulty opposing the forces on either side of the pen. And what many therapists would often offer people are these exercises, such as the ones you see on the left, photocopied sheets of exercises with lots of W's and E's and I's and T's, but that's not specific to that man's problems. He needs to practice picking up and using the pen and controlling the pen, as well as focus on letters and combinations of letters that specifically difficult for him. Other practice tasks that often therapists will give to people are copying over the top of letters or words or numbers. And again, that's not going to be specific to his problems. So we want to give you ideas of other specific exercises that would be relevant depending on the difficulty the person has. First, I'm going to talk about the evidence of effectiveness. There are 4 reviews that are relevant here. The first 3 were published in 2011, and the one at the bottom I'll talk about in a little while is just an abstract. It's not a full paper in the American Journal of Occupational Therapy. The 2 top reviews are systematic reviews, and many of you will know that that means a very systematic search for studies of different designs. And the first study, which is of pediatric studies, is relevant because there is more research on pediatric handwriting interventions, and we can learn from that as being the next best evidence in the absence of much adult handwriting research. So this Canadian study collected together 11 randomized and non-randomized trials of interventions to improve handwriting in children. And what they found from those studies is that for interventions to be effective, they had to include practice of handwriting and enough practice sessions to make a difference. So it was 20 or more practice sessions. Now, you might be thinking, well, what else were therapists doing if they weren't doing handwriting? Well, quite a lot were doing sensory-based training, which meant the child might be making the shapes of letters on sandpaper or in rice or in sand, but not using a pen or a crayon or a pencil. So the studies that showed benefit and improvements in handwriting used implements such as pens and pencils. And Kathleen Yankuchek in the United States also did a systematic review published in the same year of adult handwriting interventions. And she was looking for any interventions not specific to stroke that improved or attended to handwriting. She found 4 trials that focused on adult interventions. 3 were voice recognition software that compensated for your inability to write. And 1 study looked at transfer of dominance. So if you were right-handed and you had to learn with your left hand, that was the focus of the training. There were no studies that focused on training handwriting of a hand that was affected by a stroke or a brain injury. They also included, because there was so little research involving adults, they looked for interventions involving children and came across another 10 studies targeting children's handwriting. And as you can see there, again, direct practice of handwriting was an important component of the studies that were effective. Nadej van Dremt also published a study in that year with myself and Natasha Lannon as part of Nadej's master's research. And she was doing a literature review, or what we used to call a literature review or a scoping review. She found that younger adults write more legibly and they write faster than older adults. That it's quite common for adults to use a range of different grips, not just the traditional tripod grip, and that the writing is still functional and legible. So you don't need to change people's pen grip unless they're having problems controlling the pen, such as the man that you saw in that video. It's quite common for adults to change the letters as they're going across the page. So go back and correct a T or an I or an A, to close off letters, to tidy up letters. So don't penalize people if they're doing that when they're writing. It's also very common for adults to use a mixture of writing styles. And by that, I mean to put printed text in the middle of a word or a sentence, along with joined up cursive writing. And quite often the pediatric handwriting assessments, they will penalize children for mixing up printed and cursive text in a word. But we found in our research that that's quite common in older adults. The fourth review here by Beth Ickelman and her student colleagues was a conference paper at the American Occupational Therapy Conference earlier this year. And Beth kindly sent me a copy of their scoping review. They were looking at studies that either help to remediate or restore handwriting. And when they found only Bronwyn's study and one other study with a single participant, they broadened their search to include studies that restored or remediated fine hand control. So they have 20 studies in all, but most of those studies include interventions like mirror therapy and constraint therapy that are not specific to handwriting. So unfortunately, the scoping review hasn't so far produced any new research that we don't know about on handwriting interventions. So in summary, we know that handwriting practice needs to be specific to handwriting and include the use of a pen or a pencil, and needs to probably include at least 20 sessions and not exercises such as those photocopied sheets that many of you will have had in your filing cabinets at work. We've also done some research over the years with people who have not had a stroke or a brain injury to try and understand how people spend their day when they're writing. So Nadej, who I've mentioned before, and also an honours student, Megan Gozard, collected data from healthy older adults using a digital pen. And these individuals were asked to carry the digital pen and to use the pen for 3 days consecutively. And then the pen was docked and they were able to see what people had written, how much, and for how long, and what activities they had done. These were age matched to the stroke population. So Nadej recruited 30 older adults, and Megan recruited 16 younger adults age matched to the traumatic brain injury population. The results were quite similar. So people don't write very often. These older adults who were, many of them were retired, 2 or 3 of them were still doing some paid work, but they only wrote on average 3 times a day. And each of those samples of writing only usually accumulated 2 or 3 lines of text. So the sorts of writing that you're doing now, if you're taking notes, is the example of the kind of writing you would expect people to do. You don't write a page of text in one shot, in one go, unless you have a job that involves lots of copious writing. The other interesting finding is that most of people's writing is self-generated. So you're writing a message about something you might need to do later on. It might be to do with your dinner. It might be somebody you need to phone. And also puzzles such as Sudoku and crossword puzzles were very common. In the younger population, and these were some students, a stay-at-home mum, a shop assistant, a truck driver, aged between 20 and 24, they were writing a similar amount of text. And again, most of it was self-generated rather than copied. So the messages from that are that you should, if you're going to be giving people practice tasks and doing practice in sessions, don't ask people to write long pieces of writing. 2 or 3 lines at one time is enough. And if you think about that man in the video, he was having difficulty even doing 1 line of text. and also include both copied and self-generated writing. So copied text is easier for people because they don't have to think and process information at the same time. But the reality is that much of what we will be doing will involve thinking and planning at the same time as writing, or before you write. So I'll stop at that point and see if there are any questions. Carla Bronwyn?
There's been a couple answered in the Q&A by text, unless anyone needs to raise their hand. Nothing unanswered at the moment.
Okay, I'll keep going. Next, I'll talk about the Handwriting Assessment Battery, which Natasha Lannon and I put together back in 2003, so quite a long time ago. And then Katie Faddy, who was an honours student at the University of Western Sydney, did her honours research looking at the psychometric properties of the Handwriting Assessment Battery. So it's a test there's one publication on this instrument, and Bronwyn's research that you'll hear about also used the HAB as one of the outcome measures in her study. Michelle Detrick-Janes also looked at the legibility components of the HAB, and Justin Scanlon's been involved in some of the research. So there's a number of people over the years who've contributed to the development of this instrument. When Tash and I put this together, we didn't want to spend 20 years working on an instrument, which we have in fact done. So we chose to take subtests from other instruments that were already existing. So there's three parts to the HAB that some of you will know: the pen control, the speed, and the legibility subtest taken from the motor assessment scale, the Jebsen test, and the etch. If you haven't used the Handwriting Assessment Battery before, you can download it for no charge from the StrokeEd website by going to the resource collection and then looking for the section on upper limb resources and the analysis section. So there are two documents: the test booklet that you can see at the bottom of the screen, and a much longer document which gives you information about how to administer and score the test booklet results. Michelle Detrick-Janes and I are in the process of revising the HAB at the moment, and I'll tell you a little bit about the revisions that will be going into the next version of the HAB, and we should be uploading that in the next month or two. So the first section of the HAB includes two subtests of pen control. The first is the line subtest, the second is the dot subtest. For the line subtest, people are asked to draw 10 lines across the page in 20 seconds. And the dots subtest, they're asked to draw as many dots as they can in 5 seconds. So this is what the line subtest looks like, and the dot subtest. And we know from 3 studies down the bottom of the screen that these are the two most difficult motor assessment scale subtests for stroke survivors to achieve. And for that reason, Michelle looked at, for her master's, looked at what the results were for healthy older adults, so people had not had a stroke. Could they complete these tests, and what were the typical number of lines and dots that people could achieve, so that we had comparative data. This is the main publication on that research. And what Michelle did was recruit, along with another student, and I'll talk about that research shortly. She recruited 120 older adults in New South Wales and Queensland between the ages of 60 and 99 years, who were asked to complete the Handwriting Assessment Battery subtest. And what we found, surprisingly, is that almost half of those older adults couldn't complete the line subtest. They couldn't manage to draw 10 lines in 20 seconds. A small number failed the dot subtest, but not nearly as many. So this is what we have recommended that people do, is to have 2 lines on the page, and on the right-hand side of the page, you can see whether people have accurately drawn a line, and you can give it a tick, or if they go over the line too far, more than 2 millimeters, or they undershoot the line, that doesn't get counted as an accurate line. Down the bottom of the screen, you can see for the age groups, the number of people who passed or failed the test. So 60 to 69-year-olds, 10 of those people couldn't draw 10 lines in 20 seconds. But as people got older, the 90 to 99-year-olds, only 10 of those people could complete that test. 20 of them couldn't manage the 10 lines. And the median number of lines that people could draw was 8 across the sample. So if you are going to be using this test, we recommend now from Michelle's research that you record not only if they pass or fail, but how many lines in total somebody has completed. So how quickly they can move across the page and go backwards and forwards, but also how many accurate lines they can draw within 2 millimeters of that right-hand line. So if somebody fails that test and they've had a stroke or a brain injury, it might be because of their age or their pre-stroke, pre-brain injury writing performance rather than their stroke. That was pretty interesting, I think, and important research. If somebody's slow to control the pen, like that man in the video, or to move across the page as they write, this could be a useful exercise for them to practice with you in therapy and as part of their homework. So practicing controlling the pen between their index finger and their thumb, with the middle finger underneath. And if you try that now, you'll find that after 2 or 3 repetitions, you'll probably need to readjust the pen with your middle finger, because it will start to, you'll start to lose control of the pen. So asking somebody to do 10 repetitions of this consecutively is quite a challenge. But that's what people need to be able to do as they adjust and move across the page. Any questions up to that point?
There is a question in the chat about a client with ataxia whose pen slips out of his hand a lot, and then his letters are not smooth or legible. But when he does repetitive practice like circles, they're fairly smooth and better control. Just wondering, this person's just wondering how to get that smoothness and control in more real writing.
Well, I'll talk about ataxia first, and we've talked about ataxia before. It's really not that different to somebody who has a motor control problem of any other type. If they're holding the pen too tightly, which often is common with ataxia because people can be quite strong, then they have to learn how to adjust the force. Like that man in the video, he was pressing too hard with his long finger flexors. That was my hypothesis anyway. And to start using the appropriate muscles and the appropriate forces on the pen. So if somebody's able to control the pen when they're doing zigzag lines on an exercise sheet, but they can't apply that when they're writing, that's a perfect example of why you need to do task-specific training of the letters or the combination of letters that they can't manage. So if it's the T's or the L's or the closing off of O's and E's that are more difficult, or if it's a Chinese script and there are particular characters that are problematic, then they're the letters and the combination of letters and characters to practice. If the person can only manage 1 or 2 letters at a time before they start to lose control of the pen, then stop at 1 or 2 letters. Get them to readjust the pen and then start again. Don't ask the person to do 5 or 6 letters in a row because they'll fail. They won't be able to do that well. Any other questions?
That's all in the Q&A box. Thanks, Annie.
Okay. The second part of the HAB is a speed subtest. And if you've done this before, or have used this before, you'll be familiar with the 24-letter sentence, which is a subtest taken from the Jebsen test of hand function. We've added a second speed test, which is a self-generated shopping list, which will be in the new version or the new edition of the HAB. This is a publication by Donnie Berger, who also used that sample of 120 older adults in New South Wales and Queensland, and she looked at their speed results and provided some data in this publication in 2011 on the speed of adults 60 to 99-year-olds. So for the Jebsen, the 24-letter sentence taken from the Jebsen, she was able to provide a comparative set of data for the Australian sample. At the bottom of that table, you can see in orange, with the study from 1992 from Haeckel and colleagues in the United States. And at the top, you can see the 1982 sample, which was a Brisbane or a Queensland-based sample of 385. But if we look at the Haeckel sample, 120 people between age 60 and 90, and the Australian sample between 60 and 99, the males between ages 60 and 69 that you can see highlighted took about 15 seconds to copy a 24-letter sentence. The Australian men between age 60 and 69 were faster. They only took 11 seconds. The women who were between 80 and 89 in the American sample were taking 18 seconds, and the Australian women of the same age were taking 14. Now, that's a very small variation, but nonetheless, there are some differences in the speed. The Australian sample that was published in 2011 were a little bit faster overall. But also what we can see, this is a table from the revised administration and scoring guidelines that you'll be seeing when we put them up. We have pen and pencil data, but we can see here that as women and men get older, they get slower. So speed decreases with age. On average, 22 to 23 seconds to copy 24-letter sentence, whereas if you're younger, 60 to 69, you're typically taking 11 to 12 seconds. And pen is generally faster than pencil, maybe because when you use a pencil, you make adjustments as the pencil lead wears down and changes the nature of the lead. Not really quite sure about that, but generally pen is faster than pencil. So the second subtest that you'll see in the new version of the HAB is a self-generated shopping list where the individuals are asked to think of 5 grocery items and then to write those 4 items, and they're timed. If the person can't think of 5 grocery items, you can give them some ideas. If they still have difficulty, you can give them a catalogue, such as a Woolworths or Walmart catalogue, to prompt ideas. So we know from the research that I'm just reporting on here that copied text was written faster than self-generated text, so you don't have to think as much. And that's the reason for including copied and self-generated text, to look at the speed of the 2 different types of writing. So in summary, people can write faster when they copy. People slow down with their writing as they get older. The speed data we collected in Australia showed that people were a little bit faster than they were in the 80s and the 90s. We also know, and you need to keep this in mind when you're getting people to write legibly, is that they will write more slowly. And if you ask somebody to write fast, as fast as they can, their legibility will decrease. So if somebody has a speed goal, they need to write more quickly when they're writing their signature on forms in hospital, then practice with copied text. But if legibility is the goal, then probably self-generated practice, more self-generated practice is important. And here's another practice sheet that might be relevant for use in those sorts of scenarios. So we've got a page of paper, and the person's going to be writing 6 words, one at the top left, then across to the top right, middle of the left, middle of the right, and then down to the bottom left and the bottom right. And you can score both speed and legibility to see how fast people are moving across and down the page, as well as how legible they are. And what you typically will see is as people move across to the right-hand side of the page, their legibility will decrease. And as you move to the bottom of the right-hand side of the page, again, the writing will deteriorate. So it's a combination of probably just deterioration in control, but also shoulder control. If you have poor shoulder control of external rotation, across to the right-hand side of the page, often people are less able to control the writing. If that's the case, maybe draw a line down the middle of the page and just get people practicing on the right or in the right bottom quadrant of the page. Legibility has been the focus of many people's goals over the years and is often their priority rather than speed. For the reasons that you can see on the page here. This is an example of somebody who's had a stroke, and really it's very difficult to see what they're writing in that piece of text. In the existing version of the HAB, there are 4 subtests for legibility. There's the alphabet written in capitals, the alphabet written in lowercase, numbers 1 to 12, and then a 5-word sentence that the person has to write. The only component that we've retained in the next version of the HAB is the 5-word sentence, because most people don't write the alphabet, and it takes a very long time for people to write the alphabet if you're as slow as that man you saw in the video. So the bottom text you can see on the screen at the moment, this man's writing, "I bought a beautiful mohair rug." Still quite hard to read that sentence, and it took more than 2 minutes to write, which is pretty slow. So in Michelle's other research study, she looked at different versions of rating scales, and we're now using this 4-point rating scale called the modified 4-point scale as part of the HAB. It's much quicker and easier to score than the previous scale that we were using. So in this scale, the person's writing is examined and you look at the writing, and on the very first read, you decide if the words or the sentence is legible or not. So if we're looking at the sentences you can see on the screen at the moment, the one at the top is really not clear. You can't really tell if any of the words or what any of the words are. So if none of the few of the words are legible, it's a score of 1. If, on the other hand, upon first read, most or all of the words are legible, then it gets a score of 4. And in our sample of 120 healthy older Australians, most people got an average score close to 4. Mostly their words were legible. And what we know from the research, and Michelle wrote about this in her article, when we read the beginning and the end of a sentence, and if we can tell the context and we can read the beginning and the end of a sentence, our brain makes sense of it and we can understand it. But if there's really very little that we can understand, like the top of that top row, then you just can't understand what the sentence is. And then the second scoring system is the word legibility. So when somebody has written five words in their sentence, we look at each individual word and decide if each word is legible or not on a scale of 1 to 4. So in that top row, the word next is really hard to understand, but the word coffee is legible. So that would be 50% legibility. So if 4 of the 5 words are legible, the person gets an 80% legibility score. And mostly we could read people's words, and they got a very high word legibility score of 97%. This is one example of a stroke survivor whose writing was really not legible. So he got a score of 1 for the sentence. And that's what he had written and was intending for us to read. Here's another example of a sentence that was slower. A score of 1 again, because really it's not easy to read that sentence. And this was what the man intended for us to read. So in summary, it's quite common for about half of the words in a sample to contain illegible letters, but our brain's able to understand the writing and the sentence because we look for the first and the last letters and the first and the last words, and we can fill in the gaps. So we don't read letters in isolation, which is what we used to do when we were scoring the HAB. We know that self-generated sentences produce the best legibility, so it's a good place to start when you're doing practice with people, and use copied text if you want to improve speed. And focus on letter formation. So look at which letters are most problematic for people. Is it the first and the last? Because that will improve their legibility if we can understand the beginning and the end of a word in a sentence. Or is it more the ascenders and descenders? For example, in this sample here, if we look at the word beautiful, the B is not really easy to recognize as a B. It could be a V or an L. And the L at the end is really hard to recognize as an L. So if we just focused on the B's and the L's, it might be that the person's ascenders, that's the letters that go up, and their descenders, the letters that go down, will improve, and their overall legibility may improve. So here's a third example of a practice sheet that looks at letter formation, where the H and the ascenders of the H needs to improve and be longer, and the descenders on the P in shopping need to become longer, and the closure of letters like O's need to also improve. Moving on now to the fourth and the new section of the hand is called the neatness component. And this was introduced as a result of Bronwyn's research, where the participants often had legible handwriting, quite high legibility, but they weren't happy with the look of their writing. And what you see on the screen at the moment is one example of legible writing. We can read that sentence, but the man concerned was not happy with the untidiness of his writing compared with pre-stroke. So Michelle's developed a new instrument that is part of the HAB now called the HASI. And it hasn't been tested yet for the psychometric properties, but we think the clinical utility is important and we'd like you to try it. And we think you'll find it useful. So individuals are asked to tell us about the overall look or the appearance of their handwriting, and whether they're satisfied with the look and the appearance of their handwriting, and if they'd like to work on that in their therapy sessions. So if somebody's not had a stroke and it's somebody who's just got a legible handwriting because they have, you can still use this scale with them. And for each of the different components of handwriting, we'll ask them the same question. Is the spacing a problem? Is the alignment of your writing or the slant something that you would like to work on? So you work collaboratively with the person and identify the areas to focus on, and you don't just give them photocopied sheets of exercises to do. So I'll stop at that point before we go on to look at retraining and Bronwyn's research.
There's a few questions, Annie. Improving the writing of a client who has very small and overlapping handwriting due to visual perceptual issues.
Well, people who've got visual problems, whether it's because of their stroke, or I was working with somebody recently who had macular degeneration and had great difficulty seeing anything on the page. So he needed to have good lighting. He needed to have lines on the page. So all the principles that you might use for people who've got visual impairments or low vision would be important to use. And looking at individual letters, that would probably be how we'd start, and making sure that people can see the edge of the page or the start of the page, and get them to talk through that as part of the planning process, as well as the doing of the writing.
Best source for the scoring tables, I assume they're referring to the modified 4-point scale. I don't know if you want to pop them in.
They'll be in the revised version of the scoring booklet for the Handwriting Assessment Battery, but they're also in the article that Michelle Detrick-Janes published, and you'll see that in the reference list at the end.
I've half answered this by suggesting the sensory discrimination training, but do you have anything to add for handwriting problems for someone who has sensory loss as well as motor control problems?
Yeah, I mean, this would be a very good task to include in task-specific sensory retraining, the picking up of pens and pencils, and getting people to recognize the different features of the pens or the pencils, and recognizing when the pencil is in their hand and not in their hand, so that they're getting feedback from the implement. And I guess the pressure down through the page and getting feedback on that.
I don't know if we want to hold this off till after my section, because it does come up, about the dilemma of dominance transfer, particularly in a vocational setting where I assume slow and poor handwriting would be a disadvantage, and it's important to get someone back quickly to work.
I might leave that to you to talk about when you get to that.
Okay. And last one, a client who regularly fatigues and experiences hand cramps. Any suggestions for how to manage this with handwriting?
Yeah, I mean, I've seen a couple of people privately over the years who had cramps and fatigue in their hand, nothing to do with a stroke. And really it's about getting people to recognize if there's particular ways that they write or letters that they write or amounts of text that then lead to cramps or fatigue. And then, slowly trying to increase the amount of writing that people do. But my limited experience is that people just need to stop more often when they're writing, and often giving people feedback about the amount of pressure that they're putting through the pen or the implement, which we often do with cutlery when somebody's had a stroke. So getting people to recognize and giving them feedback as a coach regularly about the fact that their nails are white. You can see that they're pressing really hard while they're writing. Okay, I'm going to hand over to Bronwyn now, so I'll stop sharing and pass over to you now.
Thank you, Annie, for the opportunity to present our research. My background and involvement in this was in my work in stroke rehab, and we were guilty of those inappropriate handwriting exercises in our filing cabinet. I'd envisaged originally a quality improvement project, but that turned into a master's research project with the help of a grant from the National Stroke Foundation. So we did a feasibility study, which is a small study that aims to inform a larger randomized control trial with the aims of testing the feasibility for a study like this, in terms of recruitment, outcome measurement, as well as the intervention. The design was a quasi-experimental single cohort study, which means all participants received the intervention with no control group, and we measured outcomes to see change across time for participants between baseline, end of the intervention, and 8 weeks later. The HAB, which you're now very familiar with, was the main outcome measure. We also looked at participants' perceptions of their writing ability or disability using modified questions from the DASH, which is a self-report scale about upper limb ability. And we just changed the wording slightly of some of those questions to ask about handwriting tasks. And we also surveyed the participants with some open-ended questions about their experience of the measures and intervention. It was a 4-week intervention program based in the community, so at people's homes, workplaces, and a care facility. And the program was based on the principles of task-specific training and practice, which is not just for handwriting, but we were looking at how those principles could be used for handwriting. And I'll go into more detail about those principles on the following slides. There was 2 hours a week of supervised practice sessions with an OT, with coaching and feedback. And people were also asked to do 3 hours a week of independent practice. You can see the actual number, or the mean hours of independent practice was a bit less than this, but there was a fair bit of variability in the group in terms of independent practice that they did, which is probably your experience too, working with people. So this slide will be an overview of the intervention, and then I'll go through in more detail in the following slides about these principles. So it was a tailored and goal-directed handwriting program targeting meaningful handwriting tasks. Whole handwriting tasks for practice, and then performance and output were analysed, and problem solving was used to identify ways to improve specific difficulties. Part practice enabled people to apply those strategies to a very specific task, and then again to a whole handwriting task. So firstly, the goals, which are illustrated here. Handwriting goals included tasks like writing a letter or card, shopping lists, taking messages, writing checks was a goal back then, but will probably be less common even just a few years later. One person with a high level of impairment wanted to complete this word puzzle by herself, rather than having the nursing home staff write for her. So even with very poor writing and very limited upper limb function, this simple tasks that she could take her time with and only she needed to be able to read was a meaningful and achievable goal for someone with quite significant impairment. She could, though, hold a pen and move it. She did at least have that level of function. Goal setting included discussion of specific factors like the target audience of the writing. Is it just something they need to read themselves, or does someone else need to be able to understand it? And when others are reading, neatness or appearance might be more important as well. Signatures don't need to be readable, and they often aren't, but here consistency and recognizability are the important factors. We also considered other factors like the speed of the task and the environment it will be performed in. These types of performance requirements are important to consider when setting goals, as well as analysing handwriting performance. This table shows the category and frequency of handwriting goals, most of which related to legibility or the appearance of writing, most commonly signatures, shopping lists, letters, and cards. Most goal tasks involve quite short pieces of text, which is consistent with that research on handwriting norms. But writing letters and note-taking at work were goals for 2 participants that involved longer pieces of text. A few goal tasks involve speed as well as legibility, like taking phone messages and notes at work. Participants practice functional handwriting tasks related to their goals, which hopefully sounds obvious, considering that it is task-specific practice, but this is still a departure from those exercise sheets we saw earlier. To make the practice tasks as real life as possible, we consider factors like the speed requirement, so getting someone to practice taking notes while listening to something. Cognitive demands, so writing a phone message while a person is speaking. Posture and position, so maybe practicing writing on a wall calendar while standing. And also the materials used, so for example, writing on a real form in the boxes or writing on a thick wad of post-it or sticky notes. So I guess it looked like this on the left rather than this on the right. So the comparison here is a real task, real materials, considering the cognitive, postural and speed demands versus a non-specific kind of pre-writing task that isn't meaningful and isn't actually much easier. If they can do this, they can practice some letters and some real tasks. This table shows the type and frequency of practice tasks. Again, you can see they're real life meaningful tasks that link to the goals you saw earlier. Sometimes different or additional practice tasks were chosen for variety. Excuse me. And sometimes less meaningful tasks like copying were included at a participant's request. A couple of participants really preferred copying so they could focus on their letter formation. At the opposite end of the scale, one participant wrote a story and really loved the creativity involved in that self-generated handwriting task. An important aspect of the intervention was analysis and feedback to identify strengths and areas needing improvement, and also problem-solving strategies for improving these next time. And this is an important part of any type of coaching. As Annie's argued, therapists need to be experts at analysis, but people with stroke were also taught ways to analyse their own handwriting and problem-solve their own strategies to improve specific features. This slide shows a list of strategies one participant came up with. She added to this list gradually and she referred to it during her practice. Part practice enabled people to really concentrate on those components of handwriting that they found difficult and apply the strategies that they identified. They might have practiced individual letters, focusing on features like size, slope, closing lines, loops, height, straightness, or pressure. Or they might have also focused on groups of letters like difficult letter pairs or words, maybe concentrating on consistency of size, joining the letters, lifting the pen and moving across the page. So they're the principles. What might that have looked like in a session? So this person practiced whole handwriting tasks related to their goals of phone messages and making lists. Part practice tasks enable them to focus on problematic components of those tasks that you can see listed here. And you can see here that both whole and part practice were interspersed with feedback and problem solving in a session. The level of challenge was set and graded by considering the writing position, challenges to speed and multitasking, and also the writing materials. So in this feasibility study with no control group, we weren't aiming to demonstrate a treatment effect, but we did test the suitability of handwriting outcome measures. And there were small improvements across time for many of the measures, but with large variability in this quite small sample of 7. This chart shows sentence legibility, where the mean improved from a little over 60% to just under 80%, but you can see the wide standard deviations. Some improved a lot more than others. And importantly, we found a ceiling effect for this measure. So several participants scored the maximum of 100, including at baseline. So this limited the improvement that we could measure, because they couldn't be scored any higher than that, even if their performance improved. So our findings, including the qualitative feedback from people with stroke, influenced the amendments to the HAB that Annie talked about earlier. This issue relates to one of the 2 key discussion points I'll raise, which is reflected in the 2 handwriting samples. Both 2 different people, both samples are readable, and you can see they scored very similarly on 3 different legibility outcome measures. But there's a subjective aspect to handwriting to do with neatness, appearance, or quality that wasn't captured in our measures. And I assume you'd agree that the quality of these 2 samples are very different. That wasn't reflected in the score. And for many participants, neatness rather than readability was of concern. So this was reflected in goals like writing a neat Christmas card or writing a letter to my son's school that I'm not embarrassed about. Our study identified this important gap in handwriting measurement and influenced the development of the HASI that Annie talked about earlier that measures appearance. Another key discussion point, which we've already had raised by that very insightful question, is the vexed question of compensation versus remediation, which is a really key question for any area of rehab. So do we use remediation like our program to improve writing in a sort of usual or pre-stroke way? Or do we put in place compensatory strategies that make writing easier? Or do we replace handwriting with other forms of producing text? Obviously, this is a very complex decision. Some principles to consider are involving the client in the decisions, what's their preference and priority. So that would be part of my answer to that earlier question. Relating practice tasks to meaningful goals will be more motivating for the person. It can be quite a slog to do the practice that's required. So making sure that the person is as interested, engaged, and motivated as they can be. Potentially attending to other handwriting goals. So consider whether remediation might still be appropriate for some handwriting tasks like a signature, even if using compensatory interventions for others. And that would probably be part of my answer to that question as well. For something really lengthy like note-taking, where speed is really important, the person's performance is going to be really impacted by slow writing. And particularly nowadays when it's becoming a lot more usual and acceptable, typing might replace handwriting for that and use that as a compensation, but someone may still need to be able to quickly take notes when they're taking a phone message or something like that. So you could do a combination of the 2. It doesn't have to be one or the other. Using different forms of producing text doesn't mean the person can't also work on their handwriting with their dominant hand, and I would at least give handwriting remediation a go with their previously dominant hand if they can at least hold a pen and make marks on a page. And then another part of that answer is remediation may guide the decision. So give it a go first if you've got time. In my study, one participant went through the program and at the end decided at that point that he'd given it a go and he was going to swap to writing with his other hand. That's not necessarily easy though. That also requires a lot of practice to learn to write with the other hand. So if someone is doing task-specific practice anyway, if they can do it with their previously dominant stroke-affected hand, I would try with that. But the decision, you know, in workplaces and also schools where children may be disadvantaged by poor handwriting speed or legibility, that sort of level of impact of the impairment will also potentially sort of push the balance in favour of compensatory interventions and strategies, particularly, I guess, if it needs to be addressed quite quickly to return to work. I will just add, presumably someone may also struggle with typing if they struggle with writing, so consider dictation and voice control as an option where that's appropriate. It's not always appropriate in a workplace.
Okay, I'll let you guide the slides now, Bronwyn. So in summary, if we're thinking about retraining, next click. If the person's got difficulties with pen control, whether it's the picking up the pen or controlling the pen, such as the man in the video, or both, practicing that pen rolling exercise might help with controlling the interossei with a larger texture initially, and then moving to a pen such as the one you can see in the slides. And part of your coaching when you're with them is giving people feedback about their pressure control and their performance, and whether they're using extra muscle activity at the shoulder or in their long finger flexors, for example. Legibility and neatness are likely to be a common goal for people. Next. And if the individual letters or combination of letters are problematic, then work together with the person on identifying what those problem areas are, and then target them specifically with your practice and your practice sheets and the homework that the person does. And as Bronwyn showed you in those examples, sometimes it's a combination of letters or the transition from one letter to another that's most problematic, or moving from word to word that's difficult. So they might be the sorts of things to practice. And the article that Bronwyn published has that table that she just presented and examples. So it's a really nice, meaty publication that I think contributes quite a lot. Next. So if we have a look at this man again, just click again, Bronwyn. He has difficulty controlling the pen, and as a consequence, his legibility and the pressure on the page is problematic. So his main priority, I would think, is the actual pen control and working on the small muscles of his hand. He's likely to also have the same difficulties with using a knife. And then once he's got sufficient control, can he manage to produce one or two letters without his finger coming off the side of the pen and without pressing so hard down on the pen? Next slide. So take-home messages. We need to measure performance and give people feedback, just as Bronwyn was describing, about the legibility, the speed, the pen control, and make it worth their while to practice, because often these people are doing many, many hours of practice, and so they need to get feedback on the change. The reason that Bronwyn's study had 2 sessions a week for a month was so that people could get sufficient practice both with the therapist and during their homework as well. And we know from the constraint therapy literature that we're aiming to try and get 300 repetitions in a session, and that for writing might represent 300 letters or 300 words, depending on what people's performance and speed are like. People don't need to do whole pages of text, so don't push them to do that. Do count repetitions and record that and show people the change in their performance, both copied and self-generated tasks. And I can't stress enough that speed is not the priority for most people. Although if somebody's very, very slow with their signature and writing, obviously there are ways to improve their performance there. But usually it's their pen control, how they manage to control the pen in their hand, that slows them down. Next slide. So I'll just leave that slide up for maybe 20, 30 seconds, and we'll start to go through some of your questions. There's another 2 slides with references, Bronwyn, to go through as well. So there's a couple of other questions about writer's cramp and fatigue, and I think I've mentioned my thoughts on that already. It's whether it's from writer's cramp, which is a kind of recognized condition rather than fatigue in the hand from using excessive muscle activity, looking at how much people can write before they need to put the pen down or before they have difficulty, and then using that as a measure of performance and change. But if somebody's not able to control the pen well, like that man in the video, don't ask him to write several letters in one block. 1 letter or 2 letters at a time will be enough. There's a question about running a group. Potentially, yes, having people in a group, but you'll find it's not common to have that many people at the one time who want to focus on handwriting. And Bronwyn, would you like to comment on your recruitment for this study?
Yeah, and I think, sorry, I've jumped over my slide with the study participants, but it was about 18 months to recruit 7 people. So that was just sort of within a few centres in Sydney, but it was not a very common goal, important to people when it was, but not common. But I suppose you could include writing for someone with those goals in an upper limb group where people are working on other goals. The key is whether you can give enough coaching and your attention to that feedback and problem solving.
Yep. And my advice would be set up constraint therapy programs regularly and include people like that in your CIMT programs, because the evidence on CIMT is very strong, very robust. And we know that most therapists around the world are not offering 2 to 3 week programs of constraint-induced movement therapy. So listen to Lauren Christie's talk about that, which was a couple of weeks ago. There's a question there about building up pens or using pen grips in the first instance to help people with their grip. Certainly finding a pen that the person can hold is a good idea, but ultimately, a bit like knives and forks, they need to be able to use standard pens and pencils in many circumstances, and will want to be able to do that. So you need to practice with both. So don't just settle for the built-up pen or the thicker pen or the texter. Somebody else is asking about adaptive equipment. I think the same principle applies, whatever kind of device it is for adjusting the way that the pen is held. That's really a compensatory strategy, and most people would prefer to be able to use both pens and pencils and knives and forks that are standard in any location. There's another question about who's lifting her elbow to write and using, that man, in fact, that you saw was probably using his whole arm to move across the page, and that's a very common compensation. And that's because they don't have enough control in their small muscles of their hand, the interossei muscles in particular. So working on the interossei muscles of the hand, the advanced hand coordination that we talk about often in our workshops, would be the focus to try and then reduce the need to use the shoulder and the whole arm. So that would be my advice: target the hand problem to overcome that problem. Next question, are there any techniques to analyze and determine the amount of force being used? We didn't come across any when Nadej and Michelle were doing their research, other than sort of fairly fancy research devices that people could use in a laboratory. There may be something available now. But good old verbal feedback works pretty well. And you could see when people's fingers were starting to slide off the side of the pen. You can count how many seconds they can keep their fingers in opposition on the pen and how many letters they can do. That's a pretty good measure. The next question, would you use other practice tasks which are functional, which target the motor impairments in the wrist, which aren't handwriting? No. Bottom line is, if they can hold a pen and use a pen, and the goal relates to legibility or neatness, then use the time, the valuable time that you have with the person, to focus on those tasks and have homework that relates to that. Don't focus on another task that's not handwriting. Anyone's there that you'd like to take, Bronwyn?
I haven't scrolled down yet. No, I would like to know your thoughts on the micrographia and Parkinson's. I feel very ill-equipped with that. I think the question about finger splints is probably a similar answer to what you said, Annie.
Yeah, I mean, a finger splint might help somebody keep their hand in position opposing thumb and index finger, but you'd need to take the pen, just use a regular pen without the splint and see if they can manage to maintain that position, because ultimately that's what they need to be able to do. Micrography, I haven't worked with people with Parkinson's disease, but again, the same principles I was suggesting before about working with a person on particular letters, or how many words or letters they can do before there's a decrease in the size of the text. And it's not an uncommon problem after stroke or brain injury that people's writing gets very small, and the size might be the focus of the goals in your writing. So again, micrographia, just trying to see. Are there any treatment resources like worksheets on this? No, what you've seen in the slides here are just examples of some of the worksheets that you could use. So if you listen to the recording of this, you'll be able to see some of the worksheets and take a picture. And in some of our workshops, we have those in the notes and the manual as well. The revised HAB, we had hoped to have it ready by now, but I think it's going to be realistically another month, maybe January before it's ready. And somebody's saying, do you see handwriting difficulties as a result of motor impairments at the wrist? More often that's a compensation if somebody's had a stroke or a brain injury and they're flexing and using their wrist flexors and their finger flexors more like that man in the video. Tends to be more of a compensation. They're using excessive muscle activity in the long finger flexors or wrist flexors because they lack control in their interosseous muscles and their lumbricals. That would be the more common problem if they're able to hold a pen and make a mark on the page. And a question there from Elizabeth about shoulder problems. Well, if somebody's got shoulder pain and shoulder problems and they can't position their hand on the page, that's a separate issue to do with controlling the pen and their hand on the page. And as I said, often if somebody's got poor control of external rotation, they can't manage to write across on the right-hand side of the page. So separately, you would work on their shoulder control as part of your program. Common reasons why people can't write effectively. Well, if it's controlling the pen, then it's interosseous weakness in the interosseous muscles of the hand and the small muscles of the thumb, lumbricals as well. That would be the most common problem for people when they can actually hold and make a mark, hold a pen and make a mark on the page. And I think we're 10 past the hour, so I think we might stop at that point. And you've had a chance to see the various